respected dignitaries, Professor S.K. Jamada, Professor S.L. Patil, Executive Committee members, staff of the first grade Government College Hungund of Rani Chennamma University, Belgaum District, Karnataka State. I am very glad to be here at this webinar as a keynote speaker. This challenges and strategies in teaching, coaching, physical education for physical education professionals. It's like training the trainers. I'm really glad that you have chosen such a beautiful topic, and the 7-day program which has spread out with various excellent speakers. So, sports and physical education has gained tremendous popularity in today's world. Forgetting about these 3 months of COVID, nevertheless, sports has been, as well as physical education, have had a very tremendous effect on our society. It also incorporates social and cultural activities. Physical education or taking part in physical activities at least for 60 minutes every day has an increasing health benefits. That's the reason there has been an equal participation, both men and women. That's the reason why there has been an increased coverage via media. There comes increased viewership, sponsorship, which has led to increased participation, name, fame, money, increased job opportunities, awards, recognitions, etc. It is very important and imperative to know that knowledge of allied sports science with special reference to physical education has been very neatly put forth in our day-to-day life, along with sports, which has been a very complex human behavior or as an endeavor which percolates into our system. Several disciplines of sports science work in coordination and are interlinked. We as professionals know the importance of each and every sports science, which helps us in day-to-day life, and also it has helped us to avoid the gap between the coaches, sports scientists, doctors, and more so the physical educationists. Advanced scientific research in today's field of physical education and sports has led to various avenues where participation in physical activities has increased health benefits, where both we as doctors and the physical educators and the coaches and the sporting fraternity have joined hands. And of course, last but not the least, we can never forget about the Fit India movement, wherein on August 29th, 2019, this Fit India movement was started by our Honorable Prime Minister Shri Narendra Modi ji, wherein this Fit India movement has come up with all the people from all ages, all stratas, including the children, adults, as well as the senior citizens, to take part in day-to-day physical activities for the only reason for its health benefits. So now comes the concept of wellness and illness. So we have been always, as Indians, always been concentrating more on the illness factor rather than the wellness, because we have never thought of how to prevent illnesses, how to prevent injuries, or though we speak that prevention is better than cure, but we have always thought of cure rather than prevention of the disease or any illness. So this is the reason this wellness and illness concept has to be taken into consideration, so that more and more is spent on wellness rather than prevention of diseases. So coming into the foray of the definition of physical education in context with the Indian scenario, that education through physical activities for the development of the total personality of the child into its adulthood, and therefore thereafter to its fullest perfection in body, soul and mind. This has to be the integration where the body, soul and mind work in tandem. So here we are talking about physical plus education, wherein we also put forth our bodies, plus we also take care of the education part along with the concepts of health and hygiene. Now let me tell you that me as a doctor, or any doctor for that matter, we are seeing most of the hospitals are full because the grounds are empty. So one side is the hospital and one side is the ground. So if at all I move towards the ground, the hospital becomes farther away. If at all I don't go to the ground, then automatically I move towards the hospital. So choice is yours. So we want all the youngsters to move towards the ground rather than moving towards the hospital. So this is the reason why the preventive education is very important for today's youngsters. And we have learned a lot of lessons from the last 3 months of the COVID pandemic, and it has taught us really well what aspect of preventive measures we need to take in. So as we all know, physical activity has a lot of health benefits. So the total scenario of Fit India or the physical education or participation into sports or taking part into day-to-day physical activities, the main thing is about the health. So without the benefits, why would anybody want to take part? So it is apt for us to know the physical benefits, where every day a minimum of about 40 to 45 minutes of physical activity brings in tremendous amount of health benefits within us. Basically, it reduces your overall health risks, strengthens your bones, muscles, ligaments, tendons and joints, improve your ability to perform day-to-day activities, helps in preventing falls in the elderly people, which is very important, increase the chances of living longer with quality life, reduces chances of cancers, heart and lung diseases, good digestive system and reduce constipation, which prevents colon cancer, and most important is obesity. Obesity has become a mantra, or fatness has become a mantra of 21st century, which has a very debilitating effect on the lifestyle of today's population, and this is one of the major reasons why our hospital beds are full with youngsters. And you can see nowadays that youngsters coming out with hypertension, diabetes and early heart attacks. And of course, we do not want these young hearts to die. So each and every one of us must participate, and very important that I want to tell you is participation in exercise and physical activities through physical education or sports improves self-esteem, confidence levels, interpersonal relations, and more so to handle failure and success equally and reduce suicidal tendencies. Books will not teach this. Only participation in sporting activities, participating in day-to-day regular school physical education classes will teach you what all these things are. And most important, the feeling of well-being, social bonding and team dynamics is what comes by participation or taking part into physical activities. Of course, World Health Organization's definition is it's a state of physical, mental, emotional, physical well-being of a person and not merely absence of disease or death. So physical education incorporates all these 5 dimensions. So if you want to be healthy, if you want to be fit in life, we need to take care of all these 5 dimensions of being physically fit, mentally strong, socially adjustable, emotionally strong again, spiritually well connected. With these 5 dimensions, definitely we can be better citizens in this life. Now coming to the branches of sports medicine and allied sports science, and it is just a bird's eye view. Why a bird's eye view is because I would like all the people, the physical educationists and the students at large, to know from which department we need to take the benefit to strengthen ourselves and to improve our knowledge and skills. So first of all, the branches of sports medicine, which has been my specialty. This department of sports medicine, which is a conglomeration or multidisciplinary specialty, which not only deals with injuries, treatment, surgeries, rehabilitation of a sports person, but a complete know-how of the athlete as a complete human being. School physical education matters a lot. So the various branches of sports medicine are sports anthropometry and biotypology, exercise physiology, sports medical assessment and emergency medicine, sports orthopedics, pediatric sports, women and sports, that is obstetrics and gynecology, sports nutrition, sports radiology, sports pharmacology and doping, sports dentistry, biomechanics and kinesiology, training methods, GTMT, sports physiotherapy, geriatric and veteran sports, disability sports, therapeutic sports and recovery sports medicine. So this comprises of the all branches of medical science, right from anatomy to obstetrics and gynecology, along with the sports science subjects. So this sports medicine team consists again of 2 branches, like one is the clinical support and other one is the research support. So in the clinical support, we have the medical specialists, sports physios, sports psychologists, podiatrists or foot doctors, physical trainers, massage therapists. And the research team consists of the exercise physiologists, biomechanics, kinesiologists, nutritionists, health educators, sports administrators, and most important, both this clinical support as well as the research support are standing on a solid platform, wherein this platform consists of the coaches and the physical educationists. We cannot forget the backup or the foundation or the support from the coaches as well as the physical education professionals. So a few lines on each of these specialities, wherein the sports anthropometry or biotypology defines the ideal type of human biotype for each discipline of sports. Here comes talent identification. The best of the athletes in the world we have seen as Carl Lewis, or you take Usain Bolt. These people have been identified by the physical education teachers in their school days. Their talents were identified by them, handed over to the coaches, and what a great contribution the physical education teachers have done by giving these star athletes to this world. So the question of talent identification comes here. Along with that, we have exercise physiology, where we study about the interaction of different energy systems, study the systems and adaptations that take place due to training and it effects on performance. So basically, we also study about the blood and neuroendocrinological analysis along with the musculoskeletal changes, and more so study the human systems where the effects of training, what happens to a person when he does not train, or also what happens to a sedentary person. So in this department of exercise physiology, actually we come to know what happens on our system when we train. Then of course the sports medicine, like emergency medicine or the medical department, the assessment is done on the athletes, and definitely I would like to make a very important point, the pre-participation screening program. because now we are seeing young athletes dying in the grounds, footballers, marathoners, who just collapse and die. Who is responsible for this? Are the physical education teachers responsible? Are the colleges responsible? Or are the association responsible who are conducting, or the organizations are? So it is very important and pertinent for you as physical education directors to have a pre-participation screening for all the people who participate into sports. So the emergency medical department checks into the pre-participation screening, and of course a declaration has to be taken from each of these participating athletes that the organization or the school is not responsible. This has to be really given a legal point, and you need to speak to your directors, the university, or to a legal consultant, where you need to have a compulsory pre-participation screening and a self-declaration from each of these athletes, because we do not know which athlete or which person has any hidden cardiac defect. So there are a couple of likely causes of this sudden cardiac, like enlarged heart, we call it as a hypertrophic cardiomyopathy, coronary artery diseases, atherosclerotic coronary artery diseases, myocarditis, or less common causes like right ventricular dysplasia, Marfan syndrome, conducting system abnormalities, substance abuse, like those people may be abusing drugs, aortic stenosis, mitral valve collapse, and one more is most common cause, less common cause is the commissio cordis. Especially we see this in contact sport when there is a direct hit on the chest wall. These athletes may collapse and they may die. This is about the emergency medicine, and now into the pediatric sports, where the concept of young athletes, because we need to look into the talent identification from one aspect and train these young children, and these young children, the process of talent identification, once you have done it, these children have to be again sent to the coaching. And what about the weight training? One school of thought says that weight training should be given to these young children, and another school of thought say that we should not train these. And I belong to that school where we advise weight training to these young children right from 8 to 9 years, 10 years, so that once they enter their adolescent phase, they come out as fantastic athletes. So now again into this sports orthopedics, sports traumatology, general surgery, we definitely take these athletes who are injured to the medical colleges where these departments are situated. And we should know about the classification of injuries, to identify these injuries quickly and to treat these athletes, because if we don't treat these athletes, because we always have say that injuries are a part of the game, and you should go through these injuries, suffer, and only then you will become a good. But in today's world of sports, this has gone. You cannot remove thorn with a needle. Like we have a saying, mullannu mullindale tegibeku. No, those days are gone now. Now we have to take care of the injuries. The first time the injuries has happened, immediately he has to report to his doctor, so that much time is not wasted in treating. Rather, we need to put in a lot of effort in preventing these injuries. So we have these three types of injuries. One is acute injury, that is, this injury happens at one go. Rapid onset or a traumatic event with a clear identifiable cause, like the person fall down, he twists his ankle, or there is a fracture, or there is a head injury. This is an acute injury. Then we have a subacute injury, a period between acute and a chronic injury, which lasts about 4 to 6 weeks post injury. That is, a minimal mild injury has happened, so the athlete do not take care of this injury and says that, oh, this is not going to harm me. So over a period of time, the injury aggravates and he really cannot participate and he lands with a doctor. And the third is the chronic injury or a overuse injury or a slow insidious onset injury which has gradually developed over a period of time, which takes about more than 8 to 12 weeks. So this is what we call it as a chronic injury, which is very difficult to treat. So there are various sports injuries and conditions like fractures, head injuries, bleeding, joint injuries, soft tissue injuries, skin damages, dehydration. Then what about the injuries that happen in a hot environment at heat stroke, sunstroke? These have to be taken care. And I cannot explain each and every one, but it is a part, or at least you as physical directors, coaches should know a minimal of how to identify these injuries and immediately get them to the hospital and put them under the medical treatment. So a few points on prevention of these injuries, because it is pertinent to all of us, because 70 to 75% of all sports injuries can be prevented. It is not about only those people who are participating in sports. It is also for those people who are participating in recreational activities, amateur sports also. There are the causes are there are two types. Like one is the intrinsic causes and other one is the extrinsic causes. Intrinsic causes means those factors within the sports person, within the body. And extrinsic causes are factors outside the sports person, that is the environment. So, few points where we can prevent injuries through extrinsic causes, like outside. So, one is taking care of the faulty techniques, taking care of inappropriate training errors, mode, duration of intensity, that we call it as a FIT principle, that is frequency, intensity, time and type. What about the inappropriate clothing, inappropriate footwear, lack of protective and safety equipment? So we always feel that we are the best in the sport. So I would like to bring it to your knowledge about one of our cricket players, international cricket players, Raman Lamba. When he was in the peak of his playing days, he got injured with he had a head injury. He was not wearing a helmet. He had a head injury, and later on he died in the hospital. So his death could have been prevented. So it is very important that we play protective equipment according to the sports specification. And of course, most important is inappropriate environment. That is the reason why all the long distance races are kept early in the morning, just to prevent sunstroke or heat stroke or dehydration. So we should always keep in mind these extrinsic factors. And one more, most important is, what about the ground conditions? We need to take care of the ground conditions, because proper ground conditions are very important, so that there are no potholes, no stones, no glass pieces. So if at all we need, these have to be clear, good ground markings, good proper soil, good shades, these have to be provided, so that these extrinsic causes of sports injuries can be prevented. What about the intrinsic factors? Intrinsic factors is within my body. So one very important thing is lack of warm-up and lack of warm-down. So lack of warm-up definitely will give rise to injuries in which you are playing. Inadequate physical fitness is one of the important factors. Anatomical factors like knock knees, high arch foot, flat feet, unequal or what we call as unequal leg length deficiencies. These are few anatomical abnormalities which have to be taken care in talent identification. What about the tight muscle groups, muscle imbalances like agonist and antagonist muscles? That is, for example, we have the quadriceps and hamstrings, we have the biceps and triceps. So imbalance between these muscle group less than about 10% will give rise to an injury. What about the nutritional factors? Very important. And a history of previous injury is very important, because history of previous injury is very significant, because it gives, again, it can lead to reoccurrence of injuries. So coming into the women and sports, equal participation of women in today's world of sports, the glamour associated with it, the amount of sponsorship associated with it has increased the participation of women in today's fitness activities and sporting activities. So I would definitely say that each and every one of you must have come with some challenges of handling a female athlete or a female lady, because of the various factors associated around the women and sports. That is, what about the pregnancy? What about the menstrual cycles? Because a female athlete may have a menstrual cycle during her travel or during her sporting activities. Or you as a physical educationist or a director who is traveling with a team for an All India Intercity or any competition, if a female athlete is menstruating, will you advise her not to take part in the sports, or you advise her to take part in sport? This has been a big question mark. So we need to know what surrounds this menstruation, and I as a medical professional or a medical doctor would definitely say that these female athletes should go and participate in physical activities. Few conditions where these women athletes may have, severe abdominal cramping, severe bleeding, or we call it as a heavy bleeding, or we call it as a dysmenorrhea. So these are the types where the female athletes has to be given rest. Nevertheless, but every time she participates, she keeps on continuing in sporting activities, all these problems surrounding the menstruation will be overcome. Of course, treatment of gynecological injuries and special problems, menstruation and pregnancy are not problems. They are a natural phenomena which takes place in every woman's life. But participating into sports and having the special problems like athletic anemia, female athletic triad, these are the problems where female athletes encounter this. The female athletic triad is a dimension of three things, where there is amenorrhea, there is osteoporosis, and there is a eating disorder. So eating disorder is the grace and poise and not being fat is, in today's world of sport, has led to eating disorders. This eating disorder further on leads to a lack of calcium intake, which leads to osteoporosis. Eating disorder and osteoporosis have led to another problem as amenorrhea. It is the female athlete will not have her regular monthly cycles. So she will cease to have a monthly cycle. So all these three things will lead to a depreciation or the decrease in participation or the performance of the female athlete. So it is important for coaches and physical directors to know about the hypothalamo-pituitary ovarian axis, which takes care of all these problems. Again, we have this department of sports dentistry, where lakhs of teeth are knocked out yearly due to participating in sports. So various facial injuries and this treatment of these injuries are taken care by the dentist, and there is a big research going on these oral braces And of course, the headgears where the boxers, International Boxing Federation had announced that amateur boxers will not wear headgears or the protective equipment. But now, because they were not wearing, lot of head injuries and facial injuries happening. Now they have come up with a consensus statement that all these boxers will have to wear the headgear for prevention and protection of their head injuries. So again, the psychiatry and sports psychology. So sports psychologists are in high demand because of the aspect of psychology of sports. What about the mental training, autogenic training, biofeedback, relaxation techniques, treatment modalities and tests which takes place in the Department of Psychology, and of course the treatment of psychiatric illnesses which takes place in the Department of Psychiatry in any of the medical colleges. The next department is another very important sports science subject of biomechanics and kinesiology. Very important because prevention of injuries holds good in this department. As what is the biomechanics of injury? How do we analyze and correct these injuries? How do we prevent these injuries? Of course, the orthotic prescriptions, and what about the footwear we wear? Footwear industry itself is a $100 million industry where a lot of research is going on in what sort of footwear we have to wear in each sport, what footwear we need to wear when we are walking, when we are running, and every day we see most of these recreational walkers wearing chappals, Hawaii chappals, sandals and walking. This should not happen because should not happen because they will land up with injuries. So always wear proper athletic footwear. These people should talk to their physical directors, coaches, or also talk to their doctors who will advise them what sort of athletic shoes they need to wear, because the mileage of a very good athletic shoe is about 800 to 1200 kilometers, and after this mileage the cushioning effect of these shoes is worn out, and slowly 70% of all foot injuries come with the footwear that we wear. So next important department is the Department of Sports Nutrition. Sports nutrition is very important because the knowledge of the general knowledge of what we have about the sports nutrition, about carbohydrates, fats, proteins, minerals, vitamins and water. What is the food we give to an athlete before that is what we prefer, pre-participation or pre-competitive diet, or during the competition, and post-competitive diet is very important. What about carbohydrate loading? What about the ketogenic diets? What about water loading? What about the legal ergogenic aids? Lot of vitamins people are consuming: creatine, carnitine, coenzyme Q10s, calcium, proteins, where we see in each and every gym people are just taking the whether they are to be taken by athletes or not to be taken. These things have to be considered in this department, and we as doctors and physical educationists need to know in and out of this. Next is the Department of Sports Radiology, where sports imaging has developed tremendously in the past decade, where sporting and recreational activities have increased exponentially, and so are the problems. Technological revolution in radiology has led in studying the soft tissue injuries extensively. MRI, CT scans, ultrasonography, musculoskeletal ultrasonography, X-rays are a boon and a blessing for the early diagnosis and intervention of these problems. The next important department is the Department of Pharmacology and Doping. So we as health educators, physical educators, need to know about the definition of doping, the classes of banned substances, stimulants, narcotics, anabolic steroids, and what about the methods, blood doping, physical manipulation of these samples, and what about the dope sample collection procedure, rules and regulations, sanctions for drug abuse, and most important, India stands in second or third position in the highest number of doping cases in the world. We are only next to Russia recently, where the World Anti-Doping Agency announced that India is one among the 3 countries which has the highest number of dope cases. So we need to educate these young athletes about the various side effects of these banned drugs, and we need to educate them about what problems they will face in their adulthood, and of course not about adulthood, the present scenario where they lose everything if they are caught or if they are found to be doped. Such a grievous problem it arises now for the person, for his family, for his college, to the society in which he stays, and of course the country. So we need to seriously put a word to these young athletes where they should not take any medications without informing or without taking into confidence their coaches, physical educators and their doctors. The next department is about the sports physiotherapy and rehabilitation, where one of the speakers will thoroughly explain about this department. And of course, we have this next department of training methods, general theory and methods of training. This is very important, and I want to put a few points on this subject, because as physical education teachers, there is a big void of who will prescribe exercises for the people. What we call it as the exercise prescription. The exercise prescription, it's whose work to do. Is it about the doctors? Are the physios going to teach the exercise? Are the coaches going to do it? Or is it the work of the physical education teachers or allied medical practitioner trainers? It has been a big void. So, as we doctors give a medical prescription, who is going to give an exercise prescriptions? It has been a challenge for medical doctors also, because we as medical doctors never learn anything about exercise in our medical colleges. We never learn about the principles of training during our post-graduation days or during our CMEs. So, this exercise prescription has to directly come from the physical education personnel, professionals, coaches and trainers. So, what is this exercise prescription? Just a few words about this, because I would expect you as physical education personnel to come forward as or in giving exercise prescription to the special population which I said earlier. What about the physical fitness components? What about the periodization principles? What about the fit principles? What about the principles of training? What about the controversies, knowledge of medical problems? What about the knowledge of a little bit of physiotherapy and rehabilitation? And it is compulsory when you are going to prescribe exercises, all these things minimal you need to know. Because physical fitness is an ability of the body to function at optimal efficiency without getting injured, and more so getting involved in recreational activities on daily basis. This is about the general physical fitness. What about the sports related physical fitness? Here again we have two types. One is the health related physical fitness, and another one is the skill related physical fitness. So in health related physical fitness we have 5 components. That is, one is the cardiorespiratory endurance, one is the muscular strength, second one, third is the muscular endurance, fourth is the body composition, and fifth, the other one is the flexibility. So all these 5 health related components are important, so that any person for that matter he has to have this, so that there is an aspect of prolonging life through exercise. As I already mentioned, that is exercise as control of disease. And there are 6 related skill-related physical fitness components, being the speed, power, agility, balance, coordination and reaction time. So these training programs should be designed, or rather they should be tailor-made according to the medical problems of the person, and more so it has to be according to the age. What exercises or what exercise prescription you are going to give to a person, or for an adolescent, or for a person who is in between 20 to 30, or who is a recreational athlete, or who is an elderly person, or who is a what we call it as a senior citizen, or he may be a veteran athlete. So in order to ensure that the fitness training or exercise program are safe and effective, it is vital that the 5 guiding principles of training are to be applied. They are the principle of slow progression, principle of overload, which has these fit principles like frequency, intensity, time and type, the principle of specificity, we need to know the principle of reversibility, and of course the principle of adaptability. So along with that, we need to teach these people what are the acute adaptations which happen to the which are going to happen to that person. What are the cardiovascular adjustments? What are the musculoskeletal adjustment that happens in a person? What are the respiratory system changes? What about the changes into his day-to-day life? Each and every aspect we need to inform to these people. And very important now, coming to the controversies in exercise, because the controversies in exercise like is or can a person do certain exercises, or what we call it as a wrong exercises like neck rotation, trunk rotation, wrist rotation, knee rotation, ankle rotation, hurdle stretch, trunk twist in the gym, where we day to day see it's a trunk twister where they hold and start twisting their trunks, overhead shoulder presses. Are these exercises to be done or not to be done is very important, because at least 50 to 70% of all of you who are observing this program would definitely agree with me that neck rotation has to be done, trunk rotation has to be done, and you will definitely agree with me that most of these wrong exercises which already told have to be performed. This is the reason why we as physical educationists should have a sound knowledge of the types and movements of the joints. So in the physical education, when you are studying this bachelor's of physical education, or when you are master, you would have had a sound knowledge of anatomy and physiology, where if you think about the movements of joints, where we have the 5 different types of joints, the ball and socket joint, the shoulder and hip joint, where there is a ball and there is a socket, where only the rotational movements take place. We have the hinge joint, where you have the elbow and the knee joint, where only there is a flexion and there is a extension movement. Also on the knee joint, where there is extension and flexion, there is no rotation in this joint. Pure joint is a neck joint, that is the joint formed by the skull, base of the skull, and the first cervical bone, that is the atlanto-occipital joint, what we call it. There is no neck rotation movement. So if you rotate the skull around the atlas, that is the C1, cervical first bone, the wear and tear of the cervical bone happens very early, and you will end up with the cervical spondylosis. And of course, there might be carotid or vestibular artery insufficiency also, quite possible. So this is the reason why we don't perform these rotational movements. Of course, again, we have this saddle joint, we have this gliding joint. So again, when we do this knee rotation or the trunk rotation, there is nothing like wrist rotation, because the wrist has only your palmar flexion and dorsiflexion. It is ulnar deviation and radial deviation. There is no wrist rotation. So kindly once again go through all these movements of the joints. Again, we should know about the risk factors like history of smoking, history of alcohol consumption. What about the obesity, family history of any long-term chronic diseases. You should ask about the chest pain, shortness of breath, heart palpitations, any blood clots, infection, fever, respiratory tract infections, unexplained weight loss, foot and ankle soreness that won't heal because of the varicose veins, joint swellings, pain or trouble walking after a fall, eye injuries or any history of eye surgeries, hernias, hip surgeries. So these are the risk factors which we need to know before giving a exercise prescription. So now in a nutshell, we need to know about these health related and skill related components, physical fitness components, what we call the FIT principles of training, controversies in exercise or the wrong exercise, which I already explained, knowledge of minimal knowledge of medical problems, and the minimal knowledge of the physiotherapy. Or it is also important that we know a bit of what is called as the first aid treatment to injuries which happens. Now coming to the para sports, geriatric sports or the veteran sports. Again, the evaluation of pathology is very important. Safety equipments and orthotics, which I already explained. It comes from the department of biomechanics and kinesiology. We need to promote veteran sports, and we need to give a backup for what exercises and how they need to take part in sporting activities without getting injured. And the concept of elderly athlete, that is reversing the age-related decline in musculoskeletal function. And of course, therapeutic sports medicine, which I already told, that physical exercise as control of disease. Again, the component of exercise prescription comes in preventing diseases like cardiovascular diseases, central nervous system problems, respiratory system problems, diabetes mellitus, osteoarthritis, rheumatoid arthritis, osteoporosis, obesity, and professional hazards, and of course knowledge of stress. So this we need to have a bird's eye view on how taking part into physical fitness activities will prevent or help in control of these diseases. I wouldn't say that taking part into sporting physical activities will totally cut away the risk, but at least, and exercise or sports cannot replace the medical treatment as such. Along with the medical treatment, if we participate into or take part in physical activities, definitely physical fitness activities, at least some 30 to 45 minutes, has a very good beneficial effect on preventing or prolonging these chronic diseases. And of course, we have this recovery medicine, where the aims of this recovery medicine are to restore the physiological and psychological processes so that the athlete can compete or train again, recover from training or competition, which is a complex process and involves numerous factors. Back-to-back matches or competitions, as in wrestling, badminton, athletics, boxing, drains out an athlete completely. So the process of recovery techniques like active recovery, hydrotherapy, ice massages, stretching, compression garments. What about the nutrition before, during and after? What about the hydration techniques which are involved? And what about the quality of sleep? So these are few recovery techniques we need to know. And finally, as physical directors or the trainers who will go and train the physical education students, most physical education students lack the aspect of latest research and how to access them. We need to teach them how to access and how to take take part in research activities, research interpretation, and practical application are to be taught. They do not necessarily come from a science background, and hence the knowledge of basic anatomy and allied sports science subjects is absent in these youngsters. As physical education deals with knowledge and know-hows of health benefits, we in India lack the education of teaching the benefits of correct and proper exercises and how to apply them. Just in a few minutes back, I just spoke on the benefits of exercise. What about exercise prescription? So right from day one, we need to teach these young physical education teachers what about the correct and proper exercise techniques and how to apply them in day-to-day life. The concept of exercise is medicine. Exercise as control of disease. And of course, join hands with a yoga expert and join hands with allopathic or the modern medicine or the Ayush department and involve or integrate all of these so that the final benefit reaches to the population. Lack of teaching in disabled children and adults, especially the special population, we need again to prescribe exercise, give them an exercise prescription. Teaching of basic life support or cardiopulmonary respiratory resuscitation along with correct training of first aid are to be taught. And one more most important thing is the knowledge or what about the communication skills, very important. So these young physical education teachers are to be given special training on communication skills, and most important, then attitude, and they have to develop an attitude towards research. So all these things were like food for thought for all of you, so that you come up with your own ways of teaching, techniques, research formalities. So the faculty for these 7 days has been fantastic, and the topics which have been selected are world class. Especially I would like to take the names of stalwarts like Professor Sundarraj and Professor Kalidasan. I have known him for the last 22 years since my post-graduation days in Patiala, and my good friend Gagan Kapoor, who is talking on prevention of injuries and about physiotherapy and rehabilitation, and he was with me with the national senior men's football team in 2011 Asian Cup Doha, Qatar, and all the esteemed faculty members. I wish you all the best. And before I end my talk, I would like to just state a few lines of the father of sports medicine, Galen, who himself was a student of Hippocrates, who is the father of medicine. He stated about 1000 years back that athletes live a life quite contrary to the precepts of health, and I regard their mode of living as a regime far more favorable to illness than to health. They lose their teeth and their limbs are strained and cannot endure heat and cold, nor like Hercules wear one garment winter and summer. It is easy to discover that these athletes are in debt while practicing their professions and are never found richer later in life, while they are following their profession, their body is in constant danger. As a fact, more are crippled and the remaining die thereafter. See what beautiful lines Galan has stated during those days, and it is a fact even now. So I quote that every human being is an athlete who is walking, running and jumping in this beautiful game of life. So we as healthcare professionals, as physical educators, as coaches, it is very important to take care and part good prescription, what I already mentioned, that exercise prescription, so that we have a fit India, we have healthy young adults who are going to take India into the India as a world power, because health is a priority, and these COVID times have really taught us how important the health is, how important prevention is, and now I call upon all you health care professionals to come forward and join hands in taking India into a healthy India. Thank you one and all. Namaste.